Rwanda is one of the countries that have shown outstanding development progress in a short period of time. Across the world, the country is hailed for beating the odds, and today, Rwanda ranks among the few countries that are on track to meet or even exceed all 5 health-related Millennium Development Goals. The last 20 years have been characterized by impressive progress in many sectors, especially the health sector. Notably, health outcome indicators such as child and maternal mortality have been reduced dramatically, and access to quality services has been increased as the country is working towards achieving universal health coverage for all citizens. Integrated Health System Strengthening Project (Ihssp) is a United States Agency for International Development (USAID) funded project implemented by Management Sciences for Health (MSH) that started in 2009 for a period of 5 years. Ihssp built on the work initiated in Rwanda by the USAID funded HIV performance-based financing project through its partnership with the Ministry of Health between 2005 and 2009. Ihssp's goal was to improve the health of all Rwandans through improved access to quality health services. Over the project's life, Ihssp has contributed to the improvement of Rwanda's information management, health financing, human resources for health, quality of care, and has supported the Ministry of Health to decentralize health services management to the grassroots level. Data is useless if it only sits idle in a computer system. To encourage evidence-based policies and facilitate informed decision-making, Ihssp has played a significant role in supporting a culture of data use. In a bid to achieve this goal, Ihssp trained data managers at all levels on the dynamics of the new web-based RHMIS and how to analyze their facilities' performance.
I would say in every planning process, data is required. In every policy decision, data is required. It's the cornerstone of every looking ahead in terms of strategic planning, in terms of other policies, in terms of deciding which interventions to make in different program areas. And so that the HMIS has contributed a lot in that. And I think I'm aware that the data that we have now is quite good.
As part of a national capacity building strategy to roll out the new web-based RHMIS for staff from all health facilities, the project engaged data managers in group discussions where they analyzed their own data, brainstormed about likely causes of trends, and identified actions that should be taken by their respective facilities to improve health services and outcomes. This has gone a long way to encourage evidence-driven decision-making.
Ikoreshwa cyane tubanza tugakusanya amakuru dukeneye mu maregistre atandukanye akorerwamo hano mu kigo, twamara kuyafata tuyandika ku mapuro zisanzwe, twangiza tugakora sezi. Iyo tumaze gukora sezi biba bibaye saved mu buryo bwiza ku buryo umuntu ahita bibona cyangwa se akabimanaging uko ashaka. Twabashije gucunga neza ya mibare dufite no kuyijera neza, bigatuma nanone nko mu buyobozi ikintu cyose bakeneye ndabagiye nko gufata ibyemezo cyangwa se hari nk'ikintu bakeneye kwitaho, guhita tubaha imibare vuba twavuga ati hano bimeze gutya na gutya, nimba ari nk'ikintu bagiye gukora bagahera kuri iyo mibare atari ukujya kuyishaka cyane wenda mu buryo bugoye. Ikindi kandi byadufashe no kuzamura ireme rya service dutanga, kubera twaga dufite ya makuru yose ahagije dukeneye muri service yaro yose muri service dutangamo hano, kubera ya analyse dukora twifashishije iyi systeme batumenya tuti muri iyi service harimo ikibazo iki n'iki, tugafata n'ingamba zo kugikemura.
In 2004, the government of Rwanda started the implementation of the community-based health insurance policy. The policy was revised in 2010 to introduce greater equity into the system. The new policy required the stratification of the population using the Ihssp system, through which over 2 million households were assigned to the lowest, middle, or highest economic bracket. To support the Ministry of Health in implementing the new policy, Ihssp, together with other development partners, designed and built a database to house the information. The intensive process took just 3 months, and by 2012, about 10 million individual records, representing 99% of Rwanda's population, had been recorded.
As it was, the stratification of the population where more than 80% of the people doesn't pay taxes, so we don't know exactly the amount of their revenue. We have decided to go for a traditional way to evaluate the socioeconomic status of the people.
In order to promote equity in financial access to healthcare across socioeconomic classes, annual contribution to the CBHI scheme were set according to the 3 categories: 2,000 Rwandan francs for the poorest, 3,000 for the middle category, and 7,000 for the highest income category.
This is very important because we need to provide, in a sustainable way, more care to the people to have a better life than they have now.
The stratification process has increased access to health care for the most vulnerable in Rwanda. Inequity among CBHI members has also been reduced, and the contributions of the higher categories are expected to generate increased revenue, which will promote the financial sustainability of the CBHI scheme.
Ikiza cya mituweli ngiye mubwira jewe ejo bundi tuvuge genda umugabo mfite umudamu yagize gutya afatwa n'inda nijoro, ubwo turamujyana ariko wa gatandatu nijoro tumugejeje hano ku kigo nderabuzima, ubwo bahise bamukora transfert mujyana Nyamata. Ubwo ikiza cyanye nuko nari naramutanye mituweli batubariye amafaranga Nyamata, sanga nayo gutanga ibihumbi bijya mu ijana n'andi, ariko natanze ibihumbi 7,200. Icyo nicyo kiza cya mituweli ngiye nabonye.
Ntarayijyamo nararwaraga cyangwa nkarwaza abana nkabagumisha mu rugo kubera nta mituweli nari ifite, ariko aho nayigiriyemo umwana urwaye ngerageza kumugeza kwa muganga, byanaba ngombwa mpaye transfert ngakomeza ndi Nyamata nkana nta kibazo kubera mbanye ndi muri mituweli.
The Ministry of Health initiated an ambitious plan to train 3 individuals as community health workers in each of the country's 15,000 villages. Community health workers provide an effective first line of healthcare and referral. To support the Ministry of Health in ensuring the sustainability of this integral part of the Rwandan health system, Ihssp worked with the Ministry of Health to develop and implement a community performance-based financing program to increase access to and use of key maternal and child health services. Through community PBF, financial incentives based on performance are provided to community health worker cooperatives, groups of about 100 community health workers. Cooperatives invest approximately 70% of their funds in activities such as agriculture, animal husbandry, or real estate, which produce a consistent income stream for their members. The Community PBF scheme has bolstered performance and institutionalized support mechanisms, fostering sustainability and a process for continuous quality improvement.
Our
major objective is promoting modern poultry farming as well as crop production, especially vegetables, so as to eradicate malnutrition and other diseases like kwashiorkor and worms in this sector. Our vision is to see that our activities do not stop at cooperative members. We wish other residents to practice modern poultry farming.
My name is Mokasafari Specious. I'm a resident of Rwanda sector. Community health workers are very helpful to us, especially people living with HIV, as well as ensuring that our children don't suffer from kwashiorkor or other diseases.
Across the world, accreditation is done to ensure that medical facilities meet basic standards of care and operations. Rwanda is no exception to this process. With a growing need to accredit health facilities in the country, Ihssp initiated and facilitated the nationally owned accreditation process for Rwanda. The benefit of accreditation, it is a comprehensive approach to improve quality of health care and focuses on the holistic role of health facilities. Rwanda's accreditation progress had only reached the country's national referral hospitals in 2009. In 2011, Ihssp supported the ministry to extend this important quality improvement program to provincial hospitals. Rwandan Essential Hospital Accreditation Standards, which now govern all aspects of Rwandan hospital operations, were developed by the Rwanda Ministry of Health with Ihssp project support. At the present time, the accreditation process, which includes both assessment and facilitation to achieve standards, is ongoing in 5 provincial hospitals across the country.
When we're talking about the accreditation, it's a mirror of looking into what you do in relation to what is expected of you. And so we did set that target, and accreditation was needed to harmonize what we do. And in that harmonizing, we understand that A is done the right way, B is done the right way, C is not the right way, and what can we do? So it gave us an assessment of how we were performing at the level, measuring ourselves at the level of national and international standards.
The first meeting, we talked about accreditation. I said, what is this? I know. It is always about leadership. I am a medical doctor. I don't really have to waste my time on that. But I was totally wrong.
That's changing our mind, but now we have tools, and tools includes policies and procedures. We have operational manuals. We have all the guiding documents where you can refer and say, this is how you have to do that. So that has been the good thing. Actually, what I would say, the next step now is to try more and try to see how we complement with that. But most of the write-up has been done, and we have resources to refer to. Resource limitation in terms of everything that you need to put in place for such a hospital to meet the international norms and standards. Nonetheless, it's also another learning experience that we were able to realize that actually there is so much we can do without any excess or extra resources in terms of funding, that we can do up to 80% of what is necessary to meet the standard without extra resources, and probably needed a 20% on the things I mentioned with infrastructure development. So it has been a learning exercise, a little bit a tough one. It's a tough journey, but I would say an encouraging journey.
USAID has been a strong supporter of this initiative since its inception, and we're very proud to see the hospitals we've been working with through our Integrated Health System Strengthening Project be recognized today, and to see the certification of surveyors who will be equipped to continue this work into the future.
Every aspect of Ihssp's work was fully integrated within the Ministry of Health's existing structures and strategic objectives, thus will be sustained even after the project ends. Through Ihssp, MSH is proud to be associated with a country that has a great vision to empower its population through the establishment of a robust health system that offers all citizens equitable access to quality health care.